I pride myself in being a general plastic and reconstructive surgeon. About 50% of my clinical practice is breast reconstruction. The other half of my practice is body contouring. So that includes breast reduction surgery, that includes post-bariatric body contouring surgery. So patients who've had massive weight loss and they have excess skin and irritation and challenges with that. I genuinely believe that I've got the best job in the world. Restoring form and function is a privilege. So as a reconstructive surgeon, obviously we are bringing things back that they had previously either lost through trauma or cancer, or we are making things better. We are enhancing a challenge that they've either dealt with for many years or even a week. I get to move the field forward with my pen as it pertains to my research endeavors. I get to move the field forward as far as how I go about educating the next generation of physicians, and I think I get to carry out the most paramount and pinnacle of care.